Yo, y'all got another pair of headphones in there I can use?
King Jacob.
Siroky. And my name's Boer, and we are part of the PN program.
And this is our peer mentoring project on
how to properly change a dressing.
Hope you enjoy it. Okay, so what I'm going to do now, I'm going to show you the supplies that you need to change a dressing. So the first thing that's really important is the doctor's orders with the patient's name, date of birth, doctor, the order, and the patient's ID. We'll need that to confirm the patient's ID band when we get into the room. Also, you'll need some tape, some 0.9% sodium chloride, make sure that the expiry date is on, hand sanitizer, a dressing change that is intact and hasn't been outdated, extra gauze just in case, so we have 2 4x4s, gloves, a blue pad, and a sharps container to put your forceps into.
Okay, so now we're going to show you from step to step of proper ways entering the patient's room, checking doctor's orders and with the ID band, as well as assessing our patient. Okay, so before we walk into the patient's room, we're going to want to make sure that we have our doctor's orders with us. So we walk in, first thing we want to do is wash our hands and raise the bed to our working height. And also, then at this point, we can introduce ourselves. Hi, Michael. My name is Sarah, and I'm going to be here taking care of you today. We're just going to be doing today is changing the dressing on your abdomen. I'm checking doctor's orders with the ID band. So we have here Michael Jordan, hospital ID 1, 2, 3, 4, 5, 6, 7, 8, 1, 2, 3, 4, 5, 6, 7, 8. Date of birth. We can also ask our patients to repeat back to us his date of birth. So, Michael, can you tell me your date of birth? 1985, December 25th, and perfect, that matches ID as well. So also we want to make sure before we do any kind of dressing change that if our patient has just taken pain medication, which I see here on our doctor's orders, Michael got Percocet about 45 minutes ago, so it should be starting to work now. Okay, so since we checked doctor's orders with that, we're going to want to put on some gloves before taking off the dressing, and we're going to do our assessments. Okay, Jordan, I'm just going to be looking at your abdominal now, look at your dressing. So if your dressing has a label on it, you're going to want to check and see when it was changed last, and also would be in your doctor's orders and documentation. And according to Michael's dressing, it was changed yesterday, and they noted that there was some purulent on your dressing. And also when we take off our dressing, we want to put it away from the patient, like this. And now we can do our assessments. So I see here on the dressing that there is some there's quite a bit of redness. There's a little bit of edema around the site of the wound. Ecchymosis, a little bit of bruising. The drainage is definitely some purulent and some serosanguinous. And it is well approximated. Now we're going to do the taco, which is the type of drainage. So the type of drainage is definitely a purulent. Amount, there isn't that much amount. I would say maybe a medium amount. Consistency and color, so redness, and the consistency is a little bit of the purulent yellow, green, stuff like that. And yeah, so there's our taco. And we're going to want to turn the dressing like this and put it into our glove. And now our final assessment is, Michael, how's the pain level now for you? And is this a comfortable position for us to now begin cleaning your wound?
What I'm going to do before starting my wound cleaning is I'm going to wash my hands. So I wash my hands, and I'm going to be cleaning the table that I'm going to use for my sterile field. So I have all my supplies in the room already. So what I'm going to do, I'm going to put my gloves on first. Since our cavi wipes that we're using to clean are carcinogenic, we don't want to have skin contact. Alright, so here's my cavi wipes, and I'm just going to clean my table down. Alright, so we'll let that dry. we wait for that to dry, I'm just going to confirm again with my doctor's orders. So I'm going to be doing a wound care. So I'm cleansing with normal saline and cleaning it with 2x2 gauze. And then I'm going to secure it with a 4x4 gauze and tape the edges around. So doctor's top of our dressing tray. So we're making sure that we pull it towards us, maintaining sterility, and then making sure that we don't go below our waist level. I'm going to just drop it on my blue pad on the bed here. The next thing we're going to do is we're going to grab the plastic forceps in the tray. So you can move it around, shake it around to the spot that you'd like. So I'm going to go in trying to maintain sterility, not touching the edge. And another note is to ensure that your forceps are always pointed down for gravity. Alright, so I'm just going to grab the first tray here. And you have two in your kit, so usually what we do, we can throw away the first one, so I can put that just on my blue pad. And then now I'm going to set up my sterile field. So the next one I'm going to be grabbing, I'm going to use as my sterile field. So you can hold the 2.5 border. So you're going to put it away from me like that. Since this is sterile, I can touch that. And again, there's a 2.5 centimeter border that you can put your forceps on. So the tips are sterile and the edge here is not, so it's safe to use that way. Alright, so in my tray here, I have some gauze, a garbage bag, and 2 metal forceps, and then a couple of 2x2 gauzes as well. So the first thing I like to do, I like to throw the garbage bag out since I just use my blue pad anyways. So I'll go in here and remove that. So I can throw that away. Alright, so now I'm just going to put this down. I'm going to move my tray around just so it's easier for me to handle. So go in and around and again. So what we like to do is we like to go in and out of the house, it's called. So just maintaining sterility, going in the house and out the house, the same way that we came in. Alright, so now I'll grab my large gauze and I can throw it in the middle and out. And then what I like to do personally is I like to leave my gauze in the one section of the tray here and then put my normal saline in the other, so it makes it easier for me to get my pockets ready to clean. Alright, so I can put my forceps back in here. Alright, so I'm going to pour my normal saline into my tray. So when we pour, we put our hand over the label. Now what I'm going to do is I'm going to pour my normal saline into the dressing tray. So pick it up, staying clear of the sterile field. So again, I have 0.9% sodium chloride. So while I pour it, I'm going to ensure my hand is over the label and maintaining sterility of the cap. So I'm never going to put the cap face down on the table because that would cause it to be unsterile. Alright, so holding it up, and I'm just going to pour my normal saline in the one pocket of my dressing tray. So you can pour however much you want in. Alright. So now that I've poured my normal saline, I'm going to do my third medication check on it. So I have 0.9% sodium chloride. I'm going to be using it to cleansing my patient's wound, and I'm using as much as needed, and we've already done the expiry date, so I don't need to do it again. So I'm done with my normal saline. Now what I'm going to do is I'm going to get the pockets ready with my 2x2 gauze. So I want to come in and grab my metal forceps in the house and out the house, and maintaining our forceps facing down, kind of like a T-Rex motion. Alright, so the first thing I'm going to do is I'm going to come in and grab my gauze, and I'm going to make a pocket. So what I do with the pocket is I grab the corners of the gauze and I put them together, and I dip it in my normal saline and I rinse it out. Alright, So the first time that we cleanse the wound, we're going to go down the middle first in one motion and drop it. Okay, and now we're going to go and do it again. So we'll grab one edge, okay, so we'll go in again, rinse it out. We're going to go on the far side next, so down and drop it. And our last one, we usually do 3 if it is excessively purulent drainage happening, then we can do another one as well. Alright, so our last one, grabbing the edges.
Am I using my sterile finger in this? Am I using my sterile hand?
Sometimes it can be a little tricky. Alright, and soaking it, rinsing it. Alright, and the last side is the far side, and we drop it. Alright, so we've cleansed the wound, and so now what we can do is we can go back into our sterile field, and we can grab our 4x4 gauze. So I'm going to go in the house, grab my 4x4 gauze, coming out of the house, and we're going to just place it over our wound. So you can fix it and straighten it out with your forceps, just like that. Alright, so I'm done with my sterile field now, so I can put my forceps down. So the next thing that we're going to do is we're going to tape all 4 edges. So we have our tape here, and you don't need gloves since the wound is covered. We've cleaned it, we've covered it with the 4x4 gauze. So I'm going to do the far side first. If you are noticing more drainage occurring, we can put another 4x4 gauze on. That's why I did grab the extras, just in case. Okay, and lastly. Alright, so we've taped it. The tape is nice and secure. Yeah, except that edge. Tape it again. Okay, so now next thing I'm going to do is I'm going to make a label to put onto the wound. So I'm going to rip a piece of tape off. To make my life easier, I'm going to put it on the table and write it. So what we do is we write the date. So today is July 3rd, 2014. It is now 12 o'clock. And then you do your initials. Alright, so I have my label, and I'm just going to stick it onto the side of my wound so that the next person that comes to clean it is aware and can see it. Alright, so the next thing that we're going to do is we're going to clean up, which is really simple actually. So we can dispose our forceps into the sharps container, but for practicing purposes I'm not going to put them in because I'll need to use these again. So I can crumple my sterile field up, put it into the blue pad, and fold it all up. Throw it into my garbage, and we're going to cover the patient up. And then I can dispose of this into the garbage as well.
Okay, so after we cleaned up, we put our label, and we clean the dressing, we're going to want to provide our patient 3 teachings. So Jordan, Mr. Jordan, we're just going to, I'm going to tell you some stuff to watch out for. Please do not remove the dressing. If you are experiencing severe pain or nausea or something like that, please let us know and we can do something for that. As well as if you notice any extra drainage coming from your dressing, please let us know as well. And we're going to provide our patient the call bell, and we're going to tell our patient that we're going to check up on them in 20 minutes from now. We're going to want to lower the bed as well to the lowest it can go. And right before we leave, we're going to want to wash our hands. Okay, so that's it for our demo for our dressing change. Thank you for watching. Just 3 little tips that we could give before ending our demo would always be never turn your back to the patient. Also, always keep those T-Rex arms, always keep those forceps pointing down. And the last tip is drop it like it's hot, as Billy Joel would say. Thank you.